IVF takes about 2 weeks. It's really is a time commitment. It is about 2 weeks. So you're not sort of at the office for the whole 2 weeks. So typically ultrasounds and blood tests are done about every other day. And those are quick, about 15 minutes. You get a blood test, you get an ultrasound. It's early in the morning. It needs to be early in the morning because we're waiting on the results of the blood work to come back to know what medications to take that night. So maybe the ultrasound might be 7:30 to 9:30 in the morning. And then on average, it takes about 10 days for the eggs to grow. And so we're looking at the ultrasound and we're looking at the estrogen level to see when the eggs are mature, when they would be ready. And some people go fast and it's like 8 days, and some people go slow and it's like 12 days. Usually we don't collect the eggs or trigger before day 8 because the eggs tend to be immature and immature eggs don't fertilize. And usually we don't go past day 12 because then the eggs get post-mature and they end up being poor quality embryos and have a lower potential for chance of pregnancy. On average, it's 10 days. And then people take the trigger shot, and then usually we collect the eggs on day 12 on average. And that collection is done under anesthesia. So if people are trying to plan when to be off work, it can be a little challenging, but if you figure it's about a 2-week window, you can kind of figure out when it's a good time to do the IVF. So I have accountants who do it after tax season, and I have teachers who do it in the summer when they feel like they can have a little bit more flexible work time. We typically try to transfer the embryos 5 days after we collect the eggs, unless people are going to be doing genetic testing. If they do genetic testing, they grow the embryos out to day 5, 6, and 7. The embryos biopsy that's sent off for genetic testing, that takes about 2 weeks to come back. And once we know what the genetic testing is, then we can plan to have a frozen embryo transfer. IVF. So IUI is pretty simple. So IUI is also called insemination. What we do is we wash sperm, and it can be donor sperm or it can be your partner's sperm. And then it takes about an hour or so to wash the sperm. And then we just place the sperm in the uterus. And so it's pretty simple. It's kind of like a pap smear. You might have some spotting or cramping or rare chance of infection because it's a very soft plastic catheter. Takes about 10 minutes to do an IUI in the office, and it doesn't restrict your activity in any way. So, a lot of times we do the IUIs close to lunchtime. So usually, if there is a male partner there, they're there early in the morning around 8 o'clock, and maybe it's close to the lunchtime when we're doing the insemination in the office, and it takes 10 minutes and then you're out, and it doesn't really affect your life very much. And very low risk, and it also tends to be fairly low cost. But chance of pregnancy with IUI in someone who has infertility is not as high as it's going to be with IVF. So maybe if someone takes fertility medications plus an IUI, they might have on average about a 10% chance of pregnancy. Where on average with IVF, people are going to have about a 50% chance of pregnancy. So IVF is where we collect the eggs, and then we inseminate them or fertilize the eggs in the laboratory, and then transfer an embryo back to the uterus. And so that is, as I mentioned, much more time consuming. It has more risks. And then it also is much more costly if you don't have insurance coverage to do IVF as opposed to IUI.